Hi, I'm Presley, and I'm Dr. Manny's social media coordinator, and today we're going to do a Q&A of your most asked questions. First question I have is, what are your favorite procedures to perform?
So I like a decent variety of procedures. I like just in general breast surgery, so breast augmentation, breast lift, breast reductions, body contouring, so the liposuction with the tummy tucks, and then some facial aesthetics procedures, so blepharoplasty, facelift, that sort of thing.
Perfect. The next question I have is, if I was a patient, what should I consider before choosing a plastic surgeon?
I think that's a really good question because you want to make sure you're making the right choice. And so the things that I think are important to me are that you want to make sure that you pick a surgeon that you feel comfortable with, someone that you feel is approachable, that you can, won't hesitate to reach out to. And then you want to make sure that you pick someone that has the same vision for you and your results. And to do that, obviously you figure that out by talking to them, but you also look at their prior results, make sure that lines up with what you think looks good.
Perfect. What is the most rewarding part of being a surgeon for you?
So what I enjoy the most is where we as plastic surgeons get to come in and help patients out. And so oftentimes it's after people have had kids or lost a bunch of weight, or even are just looking for a procedure that they've spent years, thinking about, scrolling Instagram, finding the ideal look, and we get to kind of help them get to that finish line and reach their goal. And so to me, that's super rewarding.
And then, what is the biggest trend in plastic surgery right now?
I would say there's a couple of things that I would consider up and coming. So, one thing that I tell a lot of patients about is, in addition to when we're talking about body contouring, we always have to talk about liposuction, but one thing is some of the adjunct technology. And so it was interesting, actually, in clinic a couple weeks ago, a patient had previously had liposuction about 10 to 15 years ago, and she asked me, what has changed since then? And I would say that one thing that really has is we can combine liposuction with things like BodyTite, Quantum, Renuvion, depending on which practice you're going to. But all of these things add an additional tightening to the skin after liposuction to really kind of maximize your result. So I would say that's one big thing. And then one super new trend on the topic of body contouring is actually rib remodeling. And so that's where, traditionally when you look at back in the 20s and 30s, women would wear these super tight corsets to get that hourglass shape. This is us surgically kind of assisting people to get there as well. And so that's something that's kind of a hot topic in plastic surgery.
So to go back off what you said, I know quantum is a huge thing right now. Can you explain what that is?
Yeah, so what quantum does, and you'll hear us say quantum, a lot of places use BodyTite, Renuvion. They all do a similar thing in that through the same small incisions that we're doing liposuction, we actually use this device to heat up the undersurface of the skin. And so in Quantum's case, that is to about 200 degrees. And what we've seen is that you get an extra 30 to 35% extra shrinkage of the skin. So it really helps kind of emphasize and accentuate your results from the liposuction. And so, it's something that we can combine with liposuction and kind of really help get your results to the next level.
So we know now that you have officially joined North Texas Plastic Surgery. And another question that I feel like you're going to get a lot is, what made you want to stay at NTPS?
Yeah, I'm super excited to be staying at North Texas Plastic Surgery. And I feel like having done the fellowship, I've gotten a real good inside look into how the practice works, how great everyone is, both all of the staff and surgeons. And I think it's a really good place to do plastic surgery. I think that everything is focused on committing to having the best experience for our patients. And that's both before in clinic, on the day of surgery in the operating room, as well as afterwards. Everyone is super easy to reach, approachable, and really committed to doing the best for our patients.
And the last question that I have for you is, what is one thing that you want your patients to know?
I want my patients to know that my goal is to help them reach their dream body. And I want to do that through having the same vision and using, whatever techniques and technology we have available to us.
Okay, so that wraps up our Q&A with Dr. Manny. Feel free to drop any comments down below if you have any further questions for him, or DM us on Instagram at the Dr. Manny.